back to our healthcare stuff. I just, Michael is no longer here to argue with me about it, but still, and so I'm not going to go after him specifically. But I understand the philosophy that he's putting forward, and the philosophy that he's putting forward is that within a private for-profit corporation, there are incentives to reduce fraud and waste because, the CEOs and the shareholders see that as their money. And so there are very strong incentives to reduce fraud and waste. That's true. In government, there are incentives to reduce fraud and waste, but arguably they're not as strong. It depends really on who's administering it, who's running the program, who is in charge. Now, I don't in any way believe that there is more Medicare fraud in the United States than there is health insurance company fraud, although it's possible that, that there's slightly more, but still. The problem is, with a for-profit corporation, you may have less fraud and waste, although I would challenge that. I would say that we simply have to redefine fraud. Well, in fact, that's where I'm going with this. You've got a completely different kind of fraud. Instead of the kind of fraud where somebody says, somebody who's only partially disabled claims that they're fully disabled and therefore they need a free motor scooter thingy bob. This is one of the main areas actually where you find things like Medicare fraud. Instead of that kind of thing, where basically the beneficiaries of the fraud are the little people. Beneficiaries of the fraud in the private health insurance companies, in my opinion, are at the very top. And the fraud is, hey, we're doing something for you. No, you're not. You're doing something for yourself. Speaking to the health insurance companies, they're enriching themselves. I mean, any company whose CEO is taking $1 billion, who has 100 executives who make it over $1 million, we're going to end up with 3 giant health insurance companies in the United States with the vast majority of the marketplace after these mergers that are happening right now as we speak. This is anti-competitive, monopolistic, and it's like it all depends on how you define these things. This is for-profit, investor-owned hospitals, HMOs, nursing homes, and health care agencies have higher costs and score lower on most measures of quality than their nonprofit counterparts. I can cite 8 different studies that all say the same thing. The high cost of for-profit care, which is published in the Canadian Medical Association Journal, June 8th, 2004. Payments at for-profit and not-for-profit hospitals, a comparison, Canadian Medical Association Journal. Mortality rates for for-profit, not-for-profit, Canadian Medical Association Journal. Costs of care and administration at for-profit and other hospitals in the U.S., New England Journal of Medicine. Does investor ownership of nursing homes compromise the quality of care? The answer is yes. This was published in the American Journal of Public Health, September 2001. The quality of care in for-profit and not-for-profit nursing homes, systemic review and meta-analysis, this is BMJ, and for-profit health home care, for-profit Medicare home health agencies costs appear higher and quality lower when compared to nonprofit agencies. This was published in Health Affairs. So, as we saw with Rick Scott, an awful lot of the fraud in Medicare is being committed not by people like you and me or not by people of, average means. Most of the fraud is being committed by big corporations, for-profit corporations. So if you simply said you can't be for-profit, now I said you can't be for-profit. Michael said, the not-for-profit companies have larger funds left over at the end of the year than the not-for-profit. Well, of course, because they don't pay taxes on it, and so say you got $1 million left over at the end of the year, you just say, okay, there's $1 million. In a for-profit company, you got $1 million left over. What do? You distribute it to all your shareholders and your employees. But instead of $1 million left over, you probably have $10 million left over. But because you've distributed all that money at the end of the year, your income is zero. That's how they avoid paying taxes. That doesn't mean that they're more efficient. It means that they distributed the money in different ways. The not-for-profits, who have as their principal goal, their principal mission, to pay for health care or to provide it if it's a not-for-profit hospital. That's their number one goal. The number one goal is, whereas the for-profit companies, their number one goal is to make money. And after they've figured out how to make money, then they pay for your health care. And therefore, you have to jump through all these hoops and wait in line, and then you go see the doctor. Finally, you get the appointment, and then your health insurance company refuses to pay the bill until you harass them and you sit on hold for an hour and a half. And then maybe they'll pay it, or maybe they won't. Maybe you've got to fight with them twice to pay it. Oh, well, that was out of network, and all this kind of nonsense, none of which even exists in most countries. 45,000 annual deaths associated with lack of health insurance. The U.S. could save on administrative costs over $350 billion a year simply by moving to single payer. Keep in mind, if we gave every student in America a free 4-year college education, it would cost around $60 billion a year. We would save over $350 billion a year simply by going to single payer health care. That study was Cost of Health Administration in the U.S. and Canada, the New England Journal of Medicine, September 21st, 2003, and proposals of the Physicians Working Group for Single-Payer National Health Insurance from the Journal of the American Medical Association, August 30th, 2003.
You're listening to the Thom Hartmann Program. Call 202-536-2370.
I mean, it's in my opinion, there's no debate here.
To watch more clips from our programs, hit the Watch More Videos button over here. And please be sure to hit the handy-dandy subscribe button so you'll always be up to date. Tag, you're it.